Uterine fibroid embolization is one of the minimally invasive treatment options that can be offered for fibroid disease. Uterine fibroid embolization is an outpatient, minimally invasive procedure where a woman comes in an hour before the procedure lasts about an hour and recovers for several hours. After her recovery, she goes home and continues to recover in the comfort of her own home. Uterine fibroid embolization isn't a surgical procedure in that it doesn't require general anesthesia. Conscious sedation and the twilight medications are all that are required for uterine fibroid embolization. The actual procedure of uterine fibroid embolization involves placing a small IV into the artery in a woman's groin. We take x-rays of the uterus and we identify the blood flow into the uterus and into the fibroids. Once that blood flow is identified, we use special medical materials to stop the blood flow into the uterus and into those fibroids. By starving those fibroids of blood, the fibroids shrink and the bleeding quickly decreases. After fibroid embolization, the fibroids will continue to shrink for approximately 6 months after the procedure. The majority of the shrinkage occurs in the first month or two, and that's when most of the symptoms will improve. Uterine fibroid embolization has excellent results. Over 90% of women have a significant decrease in the amount of bleeding from their fibroids. This decrease is usually seen right away within the first or second menstrual cycle. One of the other results that we see is shrinking of the fibroids after the procedure. On average, fibroids shrink anywhere from 50 to 75% and can significantly decrease a woman's pain, pressure, and frequent urination. Because it's an outpatient procedure, uterine fibroid embolization allows a woman to get back to her normal life and her normal activities of daily living quicker than with other procedures. One of the other benefits to uterine fibroid embolization is that it allows us to treat all the fibroids at one time. While myomectomy might be good for 1 or 2 fibroids, uterine fibroid embolization allows us to treat all the fibroids at one procedure. Some of the risks of uterine fibroid embolization are infection in the fibroid as it shrinks, or the fibroid shrinking too quickly and falling out of the inner lining of the uterus. Common side effects from uterine fibroid embolization are nausea, vomiting, and cramping after the procedure. We provide prescriptions to women beforehand for nausea and vomiting, as well as for pain and cramping. All these medications will help prevent those symptoms after the procedure. Most women find that these symptoms resolve after about 24 to 48 hours, with most women ready to go back to work by about 3 or 4 days. Every woman's a little different, and some women recover within 24 hours, and some may take a little bit longer. But the overall benefit of fibroid embolization is that after those 24 to 48 hours of some nausea and some pain, women are ready to get back to the normal activities of daily living.
Okay, so the procedure was very quick and painless. I arrived at 7 in the morning, and I think I was home between 10:30 and 11 in the morning. So it was very quick. I feel like they have this working like a well-oiled machine. It's quick in and out. The procedure itself lasted just a few minutes. And the only side effect that I can mention is pain. You definitely have pain afterwards. I was down in bed all Friday. I had it on a Friday, so I was in bed Friday and Saturday. I started getting up on Sunday a little bit, and I decided to go to work on Monday. In hindsight, I think I should have stayed an extra day at home, but I didn't, and I still made it all day, and it was a little bit painful. So in my opinion, 4-day recovery would have been great, 4-day recovery at home.
My UFE procedure went really well. Everything went according to plan, and the nurse that I was assigned, she explained everything to me before it happened, so there were no surprises for me, which was good. And also, my initial side effect was pain. I understand that right after embolization, the fibroids start to degenerate, and because they've lost their blood supply, they start to shrink, and as a result, you feel pain. So my pain on a scale of 1 to 10 was about an 8, and that pain lasted for me for about 3 to 4 days. And after that, I was able to manage my pain with ibuprofen or Motrin over the counter with no problems.
The surgery itself was painless and kind of interesting and fun. I was awake during it, sedated but awake, very painless, pain-free, and the state-of-the-art equipment was incredible. I got to see him going and getting that little fibroid, and it was really incredible. I want to say that the major pain was done like by the end of the next day. You know, I just stayed on top of the pills, but it was pretty easy for me.
The reasons that made me choose the UFE versus the other options was, number one, that it was minimally invasive. I'm sort of a natural person. That the natural choice is always my first choice. And so if I don't have to have an organ removed that doesn't have cancer or doesn't have any other problems, that would be my first choice. So minimally invasive, no trauma, no blood loss, no possibilities for infection afterwards. Also the recovery period. Based on what Dr. Harris said, I should be fine in between 3 days to a week, and it actually was exactly like that. So it's been about 8 weeks since I had it, and I would say after the second week I felt immediate relief. I used to feel a little bit of pressure in my abdomen area. That went away within 2 weeks, and I am happy to report I had my gynecologist follow up, a different gynecologist that is. I have switched doctors since then, and based on the size that they were before and based on what she could feel, she feels that they've decreased by about 50%, 50. So in terms of the difference, again, because I didn't have a lot of symptoms, it's not like I had pain. I still don't have pain. I never did. But in terms of the pressure in my abdomen, that's all gone away. One of the fibroids was pushing against my bladder. I can definitely feel the difference now. And it's been, after 8 weeks, I feel great.
It's been about 2 months since my procedure, and all of my fibroid-related symptoms have either gone away completely or they have improved a great deal.
I had my surgery the day after Christmas, and it was perfect because I had that break to get better. But the very next month, when my menstrual cycle came, it was just a very normal bleeding level. So I feel like it was perfect. It didn't interrupt with my hormones, obviously. I haven't had any negative side effects. It's just did what it was supposed to do, so I'm thrilled.
One of the things that I found out is that a lot of the fibroids go away after menopause. I'm 10 years away from menopause. If this buys me 10 years, I think is definitely a good investment and a good decision, because I don't have to go through hormonal replacement. I don't have to go through the physical uncomfort that comes with having a hysterectomy, even a partial hysterectomy. So to me, those were very compelling reasons, and again, one of the reasons why I agreed to do this video is to just help women make the most educated decision. And again, if the decision is that you have to have a hysterectomy, then at least you did it knowing all the other options that are available to you.